Hi, my name is Kirsten Dominic, and I'm a registered nurse with the University of Utah Hospitals and Clinics in Salt Lake City, Utah, as well as a DNP student with Gonzaga University. I'd like to take this opportunity to talk to you, the policymakers of our nation's healthcare system, about an epidemic that we are facing, and that is child and adolescent obesity. I'd like to start off by explaining how the obesity epidemic is affecting our youth, as well as our nation's finances. I would then like to talk about some proposed changes that I have to current policies, as well as have you help me in enacting a law that will help decrease this epidemic in the future. Currently, 17% or 12.7 million of our youth ages 2 to 19 years old are obese. Some of the secondary diagnoses that we're going to be seeing in the future is increased diabetes mellitus, cardiovascular disease, and degenerative joint disease. Financially, about $14 billion is being spent annually on the youth in terms of obesity and secondary conditions. $140 billion is spent annually for all of the obese patients in the nation. Our government hasn't been ignorant to this epidemic, and in 2010, the United States Preventive Services Task Force implemented a recommendation stating that all children ages 6 and older should be screened for obesity and referred to intensive behavioral interventions. While this has been a good start, it is exactly that, just a start. Across the country, only 16 states are providing coverage through insurance, cover nutrition counseling, and other behavior modifications. Medicaid will also cover some of these interventions. However, they will only cover if they are provided by a primary care provider. What I am proposing is that we make some adjustments to this recommendation. A national clearinghouse guideline that is based off of research stated that children should be screened at age 2 for obesity and that we should start educating families at the time of a patient's birth. If we change the recommendation to this, we may see a huge decrease in the amount of costs that we're spending on the obesity epidemic. I also propose that we all take a look at Senate Bill 1509, and that is the Treat and Reduce Obesity Act of 2015. This bill aims to amend Title 18 of the Social Security Act to authorize the Department of Health and Human Services, as well as other primary care providers and other authorized providers, to provide intense behavioral treatment to our patients. In review, I believe it is clear that the obesity epidemic is severely affecting our nation's population as well as our nation's financial debt. I believe that making these recommendations to United States Preventive Services Task Force and screening children at age 2, as well as requiring that education is provided to families at the time of a child's birth, and enacting Senate Bill 1509, we can have a better future outcome for our healthcare. Our nation's youth will see a decrease in secondary diagnosis as they grow up, and we will begin to see a decrease in some of the healthcare debt that we are facing. I appreciate your time in listening to the speech, and I hope you make the right choice in helping me enact Senate Bill 1509, as well as in fighting for some changes to the policies that our healthcare system has implemented so that we can see a better outcome for our future. Thank you.